Hello everyone. I feel extremely honored to have this opportunity to make my presentation here today. My article title is The Effect of Physical Activity on Subjective Health Status Perception in Elderlies with Metabolic Disease. I am Youngsoon Choi. I wrote this article with Chung-Uk Heo. Introduction. In the future, reaching 20.3% in 2025, and Korea is expected to enter an ultra-aging society, expected to be 43.9% in 2050. In modern society, the general standard of living has improved due to the development of science, the improvement of national income due to economic growth, and the improvement of the living environment. The average lifespan of the elderly has been expanded due to the improvement of health status, due to the development of medicine and improvement of health and hygiene. Elderly means to decline biologically, physically, mentally, socially, and spiritually with age. It is defined in various ways according to social and cultural circumstances and aging phenomena that show individual differences. Korea's aging population is progressing rapidly, and the proportion of the elderly population, which is the composition of the elderly population 65 years old and older, to the total population, is predicted to increase from 15.7% in 2020 to 40% in 2050. Metabolic disorders refer to diseases that originate from abnormal metabolism of glucose, fat, and protein, and mainly include hypertension, diabetes, dyslipidemia, and cardiovascular diseases. When an obese person loses weight by 5 to 15%, the systolic blood pressure decreases by 10 mmHg and the diastolic blood pressure by 20 mmHg decreases. It has been reported that the risk of developing diabetes is reduced by 50%, so weight loss is a treatment that can solve the components of metabolic disease. In particular, the obese elderly suffer from a vicious cycle in which the level of daily activity and energy consumption gradually decrease as various bodily functions decline, resulting in a decrease in the will to treat obesity, which in turn makes treatment more difficult. Metabolic syndrome is the state that causes this metabolic disease and is a complex syndrome in which obesity and dyslipidemia, hypertension, hypertriglyceridemia, hypo-HDL cholesterol, and obesity, which are risk factors for cardiovascular disease and diabetes, are correlated. It has been reported that people with metabolic syndrome are 5 times more likely to develop diabetes and twice as likely to develop heart disease than healthy others. The elderly are exposed to cardiovascular disease and other geriatric disease due to decreased immune function. In this respect, the importance and necessity of exercise as an effective method for prevention and treatment of the elderly is emphasized, but it can be seen that the actual exercise rate is low at 19.8%. Improvement and maintenance of physiological functions through regular exercise can be expected to delay and prevent various diseases. Physical deterioration, aging, and changes in physiological functions which are inevitably caused by the elderly. It was argued that regular exercise had a positive effect on lipid metabolism, body mass index, insulin resistance, and blood pressure, thereby causing a decrease in CRP. In a study measuring the vascular inflammatory responses of CRP and WBC according to different types of exercise, jogging and aerobic dancing lowered the increase in vascular inflammation. Reduced exercise capacity is known to play a role in increasing the prevalence and mortality of cardiovascular disease as well as metabolic syndromes such as obesity, insulin resistance, hyperlipidemia, and elevated blood pressure. As such, exercise is an effective means to prevent and treat cardiovascular disease of metabolic syndrome. The increase in metabolic disease is putting a burden on national medical expenses. In fact, hypertension and diabetes mellitus are single morbid diseases, and they are the first and second most common medical expenses, so reducing metabolic disease is an important issue for living a healthy life both economically and physically. However, although there are many studies on the relationship between obesity and metabolic disease, studies on physical activity and body type recognition of the elderly are insufficient. Study aims. This study analyzed the effect of physical activity on subjective health status perception in Korean elderly with metabolic disease. Based on the results, it was intended to suggest the importance of physical activity, and based on this study was conducted to provide basic data for developing health education materials and nursing intervention programs for metabolic disease patients. Research design. This study was attempted to confirm the causal relation between physical activity and health status perception in the elderly population. The relationship between physical activity and health status of the elderly population can be confirmed by examining the effect of physical activity on subjective health status perception for patients with metabolic disease. Research subject. The subjects of this study are the elderly population aged 65 years old, ordered among the data collected by the probability sampling method to reflect the characteristics of the population. This data is a statistical survey conducted at the national level targeting the entire population of the Republic of Korea and is currently supervised by the Korea Centers for Disease Control and Prevention. The name of the survey for this data is the 2019 National Health and Nutrition Survey. The main interest of this study is the prevalence of metabolic disease such as hypertension, dyslipidemia, and diabetes among the elderly population. Research tool. Physical activity refers to physical activity performed while working, moving from place to place, or with someone, excluding sleeping time. The data collected to investigate the physical activity of the research subjects in this study were data from the National Health and Nutrition Survey conducted in 2019. Walking, strength training, and this questionnaire were designed as follows. That is, the question is, in the past week, on how many days did you walk for at least 10 minutes at a time? The response to this was designed as never, 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, 7 days, every day. Subjective health data's perception refers to the degree to which respondents subjectively perceive their usual health. Subjective health perception used in this study used items designed to examine respondents' subjective health status in the 2019 National Health Survey. That is, in this study, the question was, how do you usually think of blah blah's health? The collected data were used as question items designed, such as very good, good, average, bad, very bad. Data collection procedure. The data used in this study were obtained as the researcher applied for the use of the original data of the National Health Survey and the Korea Centers for Disease Control and Prevention approved the use of the data. Users who use this statistical data have pledged to follow the rules for use only for statistical analysis purpose. This data is the data that collected the effective sample of a total of 8,110 people for the first time. In this study, 1,735 elderly people who were the subject of the study selected cases from the total valid sample and used the data. The National Health and Nutrition Examination Survey used in this study is data from January to December 2019.
Data analysis method. In this study, statistical analysis of data was performed to confirm the relationship between physical activity and subjective health perception of the elderly population. The statistical program used was SPSS 21.0, and frequency analysis was performed on demographic characteristics to identify the sample characteristics of the study subject, and correlation analysis was performed to confirm the correlation between physical activity and health perception. In addition, multiple regression analysis was performed to determine the effect of physical activity on the subjective health status of the elderly population with metabolic disease. Research results. Research model correlation. Association analysis was performed to determine the correlation between variables included in the research model. The variables of the research model were subjective health status perception, the number of days of walking per week, the number of days of strength training per week, the amount of alcohol consumed per session, the number of cigarettes smoked per day 등 human residence and age. Pearson's correlation analysis was performed to determine the correlation between variables, and the results shown in Table 2 was obtained. As a result of examining the correlation between the research model variables such as subjective health status, perception, physical activity, working, strength, exercise, drinking, and residence show positive correlations. Respondents' age showed a negative correlation between subjective health status perception and age. Relationship between physical activity and subjective perception of health status in hypertensive elderly. Association analysis was performed to determine the correlation between variables included in the research model. Table 3 showed the effect of physical activity on subjective health status perception of hypertensive patients. Since the significant probability of this model is 0.000, the regression model is statistically significant at the significance level of 0.05. It was found that walking, strength exercise, and alcohol consumption had a significant positive effect on subjective health status perception in the elderly population with hypertension. It was found that the number of walking days per week, the number of days of strength training per week, and the amount of alcohol consumed per week in the elderly with hypertension increased subjective health status awareness. Relationship between physical activity and subjective health status perception of dyslipidemia elderly. The effect of physical activity on subjective health status perception of dyslipidemia patient is shown in Table 4. Since the significance probability of this model is 0.000, the regression model is statistically significant at the significance level of 0.05. It was found that walking and strength exercise in the elderly population with dyslipidemia had a significant positive effect on subjective health status perception. The relationship between physical activity and subjective health status perception of diabetes elderly. The effect of physical activity on the subjective health status perception of diabetes patients was shown in Table 5. Since the significant probability of this model is 0.000, the regression model is statistically significant and the significance level of 0.05. It was found that walking and strength exercise in the elderly population with diabetes had a significant positive effect on subjective health status perception in the positive direction. Conclusion. Based on the result of this study, I would like to make the following suggestions. First, there is a need for continuous research on factors affecting metabolic disease and physical activity in the elderly. Second, it is proposed to develop an intervention program to reduce metabolic disease in the elderly and conduct research to identify its effects. Third, as it does not include past or family history, which can be an important trigger of metabolic disease, additional research is needed. Thank you for listening.